This is James Estes, and this is my diabetic foot exam. Nursing 500, UAH, Graduate School of Nursing. Good morning, Miss J.
Good morning.
How are you this morning?
I'm good.
My name is James, and I'm the nurse practitioner for Dr. Bob. And this morning we're going to be doing a comprehensive foot exam to check for any problems you might be having with your feet related to your diabetes.
Okay.
Have you been doing this at home?
What?
Checking your feet.
Yes, I try, but I don't know if I'm doing it right.
Okay. Well, we're going to go over a few things today, and I'll be able to give you some pointers that you can do at home and some information before you leave.
Oh, thank you.
So if I can borrow your foot up here. Alrighty. First thing I'm going to look at is your skin on your lower leg, your ankle, and your foot. And what I'm looking for is any discoloration, any signs of skin lesions, open sores, wounds, any distended veins that might indicate poor circulation. That's pretty common with diabetes. And everything looks pretty good as far as that goes. Now on your feet, I'm going to look for any bone deformities, any ulcers or calluses that might be on the bottom of your feet. And of course you have a callus right there, which is fairly common, and some calluses are good because they help protect the soles of your feet. I'm also going to look between your toes, and what I'm looking for there is any splitting or sores that might be in between the toes. And what you need to do is you need to do this on a daily basis. Just a quick look at your lower legs and your feet. And I do this in the mornings when I get up, or I would do it in the evenings when I come home from work. And try to make sure that you do it on a daily basis so you can notice any changes that might be occurring to your feet.
All right.
One thing you can do is you can use a mirror. If you can't see the bottom of your feet, you can get a mirror and make it more accessible to look at the bottom of your feet and your soles. Diabetics are at a higher risk for foot ulcers or sores than the average person, and also poor circulation. So this causes an increased risk of wounds and sores to develop on your feet. What I'd like to do now is check for circulation, and I'm going to check your posterior tibial pulses. That's good. And then the top of your foot, the dorsalis pedis. That's good. And you have a flow of 2. Your feet feel warm, and your toes feel warm, so that means you're getting pretty good circulation, and the color looks good in them. If you have any changes of coloration in your feet, make sure you contact our office immediately. Okay. The next thing I'm going to do is, I've got this little instrument here, and it's basically just like a fishing string. It's a monofilament, and I'm going to give this to take home with you. And what it does is it helps you to check the sensation in your feet. And what I'm going to do with it is I'm going to get you to close your eyes, and I'm going to touch different parts of your foot, and I want you to tell me if you feel it.
Yes. 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 Yes.
Good. So that means you have pretty good sensation in your feet, and there's no nerve damage that's commonly associated with diabetics. So that's good. And I'm going to give this with you to take home.
Thank you.
And I would also do that on a daily basis as well, because if you begin to having a lack of sensation in your feet, then you might be starting to have some problems with neuropathy, diabetic neuropathy. And that's when you would need to also follow up with us and let us know if there's any changes to that. The next thing I'd like to look at is the conduction and the sensation in the bony parts of your feet. So I'm going to use this handy-dandy tuning fork. And what I'm going to do is I'm going to strike it, and I'm going to place it next to your foot, and I want you to tell me when you feel the vibration, when you feel it stop.
Now.
Okay. And it has stopped.
Now.
Okay.
Now.
Good. Alright, so that means you have good conduction in the nerves of your feet, and as far as bone conduction goes too. The next thing I'm going to do is check for strength in your feet. And while I'm pushing on your foot, I want you to push in resistance to me. Okay, now pull back. Okay, now I'm going to push to this way and you resist. Good. The other way. Good. So you have good muscle strength in your feet. I noticed when you walked in, you seemed to have good balance and a good gait, as we call it. Are you having any problems walking or with balance at home?
No, it's good.
Okay. Again, I want to reemphasize to you that you need to do these feet examinations on a daily basis. It's very important, because if you do develop problems with your feet, such as sores or wounds, then it could lead to some pretty severe infections, and you'd have a lot of problems. Also, as far as moisturizers or lotions, I don't recommend any heavy perfume lotions. I would use a moisturizer with lanolin. I would lotion my feet up pretty well with it on a daily basis to keep it from getting your skin from getting dried out and cracked, as well as in between your toes. But I'd make sure that I keep in between my toes dry. You don't want moisture to build up in between your toes. Do you walk barefooted?
Sometimes.
That's probably not a good practice, because a lot of times if you do develop lower sensation in your feet, diabetic neuropathy that we talked about, a lot of times you can step on objects on the ground or on the floor, and they can actually create a sore and you're not even aware of it.
Oh.
So it's probably a good idea for you to wear shoes. And not just any shoes, but you need to wear comfortable fitting shoes that are not too tight and might get your toes to rubbing against each other. A lot of times high heels are not a good idea, because the toes tend to get jammed up and they create sores. Wash your feet daily with warm water and soap. Make sure that you test the water, and I would recommend testing it with your elbow or your wrist to make sure that it's not too hot, and not using your feet to test the water, because a lot of times if you develop lack of sensation in your feet, you can end up putting your feet down in water that's too hot and scalding up, creating problems. Toenails is very important. I noticed that your toenails seem to be well manicured. I would recommend keeping your toenails trimmed straight across and not leaving an edge to prevent ingrown toenails, or leaving jagged, sharp edges so that when the toes rub together, you might create a sore on the adjacent toe. It's a good idea to cut them straight across, and to maybe use a file to keep them filed down and smooth, nice and smooth, and which looks like you're doing a good job with that.
Oh, thank you.
After looking at your feet here, I would consider you to be a low risk at this point. It looks like you're doing a lot of the right things now. I would also recommend that you come in at least once a year for an annual foot exam. And if you develop any problems anytime, make sure that you follow up and come back in earlier than once a year, so that we can examine you and treat for any problems that you might have. Call the office, make an appointment. We'll be glad to get you in. Do you have any questions about what we just went over?
That's a lot of information. I'm not sure if I can remember it all. Do you have any, do you have any literature you can give me to take home?
Absolutely. I'll make sure that the office manager gets you some brochures and information before you leave, and if you have any questions after you leave, feel free to call us back.
Well, thank you very much.
Okay, thank you.
Bye-bye.